So Dr. Bilski, I get my teeth cleaned and pretty religiously twice a year. You know, every 6, maybe
Good.
8 months.
That's
or
great.
So. Yeah. My father-in-law, he goes gets his teeth cleaned 3 times a year. Now, older guy. What difference does it make?
Yeah, there's a a coincidence with that for sure. We coordinate it that way. Most people don't know this. The reason twice a year cleanings was recommended was from a toothpaste company back, I think, in the 40s.
Oh, this was a marketing thing?
Yeah, or the 50s, and it said use IPAN toothpaste and go to see your dentist twice a year.
No kidding. No kidding. Never knew that.
It was never a clinical thing.
Oh my gosh.
As a matter of fact, I don't think many people really thought about it. Even dentists were just there to pull teeth, maybe fill them and making dentures for sure. Okay, and that's really simplifying it. The reality is that if you are a low risk for cavity patient, you do not have recession or swollen gums 2 times a year.
Right.
Those are our patients that are probably 30 and younger.
Okay.
When we start to get to like 30, 35, maybe we're smoking now, maybe we're not flossing as much. Hey, kids running around, you're not going to the dentist because they're going to the dentist, and little Susie and Johnny are going into braces, and then the last thing you need is that cleaning appointment and you're busy.
Yeah,
and really pertains to moms, because I think about 85% of our practice and across the nation, mom brings, or grandma, or aunt, or daughter, or sister brings the kid, all right? Cleanings for age bracketing, all right? When you get to be about 60, 65, almost 70, we're gonna recommend 3 times a year. So that's every 4 months. The reason why is at age 50 to 55, that's when we're seeing most of our population, men and women, coming in on cholesterol meds, diabetic medication, high blood pressure, which tends to give us a dry mouth, lack of saliva, the protection that we have against fighting cavities. So if you were a person that maybe had 1 or 2 cavities growing up, we're going to see maybe twice a year. You get to be about 50, 55, and you have high blood pressure and cholesterol. Hey, Randy, do you have a dry mouth? Yeah, I got kind of a dry mouth. Like, well, you know what? Now you got this one cavity on your root. It's not on the chewing part, not where you're flossing. It's on the root, which means probably you have a little bit more acidic saliva, or maybe you have heartburn, which is called GERD.
GERD.
Yeah, and it backs up acid reflux, which changes the acidity in your mouth. So it's a low pH, which means really, really high acid. And it starts to demineralize. It starts to eat away at the tooth. And then the bacteria that create the cavity, they love that. It's like, again, swimming in the kiddie pool, right? It's gross, but it happens. Come in 1 extra time a year. So when it's just started off as a little dot on your tooth, we just clean it out, put a little tiny filling in. Now, maybe we haven't seen you in a year, particularly with the pandemic. We're seeing a lot of COVID root caries or root cavities. Caries is the term, medical term. When you hit 75 for cleanings, we're going to recommend 4 times a year. That's based on the industry research. The American Academy of Periodontists, those are the gum specialty people that see surgical procedures being performed on older patients. They're just recommending going in 4 times a year. American Heart Association is saying the same thing. So there is a definite correlation between bacterial count, bad teeth and gums, with increase in dementia, heart disease, diabetes, lung ailments.
It's all related. I mean,
it's the
age is not for the timid.
You know,
it really is.
My grandmother, who was 96 when she passed, or 98, she said, "Youth is wasted on the young."
Yeah, darn right.
So
yeah.
it's like I'm going up on 60 in a year. I'm starting to feel it. I feel 30.
You know, I know, but it takes a little sore in the morning. It takes a little longer to heal from stuff. You can't throw a baseball as far as you did.
No, not anymore.
Well, you know, it's great to understand this because it all makes sense. You know, when I was thinking going in just to get a cleaning, I'm thinking cleaning. So I'm thinking, but it's beyond. There's a real chemistry. You brought us some chemistry in terms of the acids and all that. What it can do, and you spot stuff before it happens.
Well, here's the other thing too. You got to think about, like, women get this, I think, better than men. Women go and have their hair done right?
Yes.
Not everyone, but a lot of them do.
Yeah.
That stylist, when your wife or sister, girlfriend, aunt, mom find that person,
Yeah.
they don't switch.
Yeah, right.
That's what
Yep.
happens with the hygienists, Wendy and Linda at our practice. These girls know your mouth.
Okay.
They know every little millimeter. You come in twice a year, then you come in 3 times a year, and then you come in 4 times a year. When they see the littlest
They're
change,
going to see it.
it's
Yeah.
like
Yeah.
immediate.
Yeah.
Where I only walk in by licensure and law, I need to see you once a year. We try to see you all the time, but those girls are the ones that are going to identify, like, hey, Doc, come here. Randy, he's got this spot here. It wasn't there 3 months ago. Why don't you take a look at it? I talked to Randy about it. He's going to do the filling now, and then everybody's happy. It saves on tooth loss. It saves on root canals, implants, and let's call it what it is. It saves you a lot of money. So.
Okay, so I'm going to go home, get on my calendar, and perhaps I'll schedule another dental cleaning this year because I want to stay ahead of this stuff, man.
It's not a bad thing, and at least our practice. Typically, when you go in for twice a year, it's your exams, your cleanings, maybe some x-rays. That's 3rd and 4th extra cleaning per year is only the cleaning. That's it. That's all you get charged for. So it's like if you have dental insurance or not, it's insurance when you have insurance, and it's the insurance you want to have peace of mind.
We were talking. I like to eat. I need teeth to eat. If there's anything that's worth doing, this is it.
There's 2 statements. Floss the teeth you want to keep, and then dentures are not a replacement for teeth. They are a replacement for not having teeth.
Yes, okay, well put.
So,
I think
anyhow.
these quotes need to go on your website, special page for all the folks, and let them do that.
Let's do that.
So hey, if you're coming up on the big 6-0, or maybe even a little before that, you may want to think about upping the frequency.
We have patients that are in their 30s that have cavities every time they come in. So, hey, dude, twice a year, Randy. Every year, or every time you come in, I'm doing 2 or 3 fillings. Okay. Why don't we see you 4 times a year?
Yeah, okay. It depends on your own unique situation then.
Yeah.
Okay.
We'll break you down. We'll get you in the program.
Okay. Well, hey, again, thanks so much, Dr.
my
Bilski.
pleasure.
It's always a pleasure.